during 2016, our surplus increased by 1.1 billion to 15.9 billion, which is an increase of 2% over the year. So on a regulatory filing basis, the fund is 122% funded, and that number is smoothed over 5 years. And on a mark-to-market basis, we're 129% funded. So we're in a very strong funded position.
Big difference between being in a defined benefit plan and defined contribution plan is, first of all, the scale. So we can do it way cheaper than you can do it on your own. So our cost of investing is about 0.2% per year. Most individuals, and there's lots of documentation in this, would be closer to 2% per year. So just that difference, when you start compounding that over the life of the plan, you end up with half as much money. And you would think that's an exaggeration, but it's not. And when you do the actual math on that, you see that's true. Another big difference is we pay cost of living adjustments on pension payments, and as an individual, it's really almost impossible to get that. So in individual plans, you have to deal with that whole thing as your costs go up. That's your problem. Whereas in HOOPP, it's our problem. So we have to manage that and for you. So those are a couple of the big things that you get in HOOPP that you don't get in the defined contribution plan. One of the things I think is really troubling about we've seen this shift, particularly in the private sector over the past couple of decades, of employers shifting employees from defined benefit plans to defined contribution plans. And really, it doesn't really save the employer any money, because in fact, the cost of administering those plans is actually higher. But what it does with the employers is essentially shifts the risk of future underfunding off of their books and onto the individual, and ultimately the social welfare system. So when you think about our society, I mean, Canada's a very caring society, so we're not going to allow seniors to be starving in the streets. So somehow we're going to have to pay for that. And if we don't, so essentially what's happened is that that risk has really gotten shifted to the social welfare system, and so all of us as taxpayers effectively own that risk now. And I think there's been this big stealth transfer of risk going on in the last couple of decades, and I think people are not really aware that that's what's gone on. So we're trying to make that public policy makers aware of what the implications of the shift from defined benefit plans to defined contribution plans really is to the public. Well, I'd just like to highlight to all of our own members that the plan's in very good shape. We're in a very strong position, and we certainly have the ability and plan to pay your pensions as long as you live.